Hello everybody and welcome to the Thursday edition of Video Clips. I've referred to myself as a recovering naturopath for a very long time, since I think that most of what I learned in school, including the overall naturopathic approach to health, is wrong. I was taught to be a holistic pharmacist. From a philosophical standpoint, I was taught that naturopaths are the open-minded health professionals who are willing to think outside the box, explore new options for patients, and to be pioneers in implementing new and innovative strategies. Let me give you the English translation for this. Naturopaths in general are so ungrounded that they're willing to consider almost any new idea, to recommend new strategies to all patients and clients, and when the new thing proves to be ineffective or even harmful, to refuse to stop recommending it. I've been one of the few people willing to discuss the limitations not only of naturopathic training in naturopathy, but other holistic modalities, until just a few weeks ago. Like a breath of fresh air, I read a most interesting article written by a naturopath who's decided that the profession was wrong about the vitamin D issue, finally. Jacob Shore is a naturopath and columnist for the Townsend Letter, an alternative medicine journal that does publish some interesting things. That's why I continue to subscribe to it. But more often than not, it publishes a lot of incorrect information in the form of hypotheses, long articles discussing things that might occur and possible reasons for disease, correlations, and what I think could be easily referred to as medical musings, for lack of a better term. Over the years, Townsend has featured dozens of articles about vitamin D, all promoting the idea that most people are deficient, testing is required, and supplementation is useful and perhaps even necessary for almost all people. Dr. Shore now admits in this article, quote, vitamin D supplementation is neither as beneficial nor as safe as we once thought. Shore acknowledges that while it's true that there's an association between lower vitamin D levels and disease, quote, this may not be the sort of causal relationship we assumed. He goes on to say that with vitamin D, quote, we jumped the gun in thinking vitamin D was going to be a panacea. He explains the error of thinking as a series of assumptions that just proved not to be true. An association between sunlight and lower disease risk was reduced to vitamin D production. The logic then followed that if vitamin D is the only benefit of sunlight, rather than what it turned out to be, which is a marker for sun exposure, then taking it in a pill would be a substitute. Only it turned out not to be true, and that's the case for most instances in which medicine has degenerated into reductionist thinking. Shore says that, quote, a tsunami of studies connecting low vitamin D levels and disease led health professionals to a place that, quote, if you can name it, vitamin D can cure it. Another incorrect assumption was that there was no harm from taking vitamin D, and as a result, doses increased to the place that today it's not unusual to see people taking 50,000 international units at a time. Shore makes another stunning admission, which is that medical journals are now filled with articles showing that vitamin D supplementation is ineffective, which have been largely ignored because they, quote, do not fit our current paradigm of vitamin D benefits. He reports the results of several, which I've covered on this channel before, one of which termed vitamin D supplementation as a futile strategy for reducing deaths from cancer, stroke, or heart disease. As a result, Shore says, quote, it's time to stop thinking of vitamin D as a panacea and refer to it instead as a sinking ship. Shore expresses incredulity that his profession could have reduced the benefits of sunlight to a pill, and says that it is clear now that if patients expect to get the benefits of sunlight, they will, quote, have to do it the old-fashioned way, that is to get a tan. He acknowledges that there are risks associated with taking vitamin D, which include an increased risk of prostate cancer, heart disease, chronic kidney disease, hypertension, and increased falls and fractures in the elderly. Shore goes on to say that, quote, this is a huge change in thinking regarding what we once thought was a totally safe practice. It's also going to take a bit of explaining to the many patients we've convinced over the years that vitamin D is both beneficial and safe to take, and adds that, quote, to a growing extent it looks like we made a mistake with vitamin D. We early adopters must be willing to be the first to admit when we are mistaken. Now let's hope that others in the profession will become equally willing to reconsider not only the vitamin D issue, but the entire premise on which naturopathy and other holistic professions is built, which is being early adopters, in other words, no evidence to support, but willing to accept a theory or hypothesis and act on it, and the reductionist approach of treating symptoms instead of causes. And that's what I meant when I said earlier, the holistic pharmacist. It's easy to treat people with supplements instead of drugs. It doesn't lead to a better outcome. The bottom line is that both traditional and alternative medical systems can be helpful to patients when certain rules are followed, which include using evidence to guide decision-making, using caution when considering new ideas, avoiding one-size-fits-all approaches, and treating causes instead of symptoms. Unfortunately, all of these professions tend to ignore the rules, while each criticizes the other of being ineffective and failing to help patients in meaningful ways. Now, this is one of the reasons why at Wellness Forum Health we don't use common labels to describe our practices. Terms like lifestyle medicine, traditional medicine, holistic, alternative, and integrative all basically refer to practices that are generally not evidence-based. While well-intentioned individuals practicing many of these modalities offer some helpful advice and options to patients, most continue to offer advice that is not evidence-based. For example, we have a lot of what we call plant-based doctors still promoting vitamin D supplementation. We have acupuncturists who promote a paleo diet. Informed medical decision-making is our brand of health, and it refers to the presentation of unbiased information that allows consumers to make fact-based decisions without consideration of the label attached to the practice. It prescribes allegiance to a method rather than a modality, and allows the totality of all modalities to be considered and filtered using an agreed-upon formula. And I think this is very important. We've got to stop thinking about things in terms of traditional and alternative and complementary. And those titles mean nothing. They don't mean anything to the patient. The patient doesn't go shopping for a modality. The patient goes shopping for a solution to his or her problem, which usually involves having been sucked into the medical mill with tests and drugs and supplements and diets and procedures and all kinds of things that don't help very much. So if we look at evidence to guide decisions and we forget about the label attached, it leads us to best practices, and the patient can make a decision based on his or her value system, not the value system or allegiance to some type of modality that the practitioner may have. So I was encouraged to read this, and it led me to a great opportunity to explain where we fit in the grand scheme of things, because people often ask me, so what do you guys do there? Are you holistic people? I said, please don't call us that. That's, sort of like a derogatory term for us, because it's as is all the rest of the other terms, as are all the rest of the other terms. So anyway, I'll keep you posted. I read Dr. Shor's column, and I'm looking for him to say more enlightened things in the future. Well, that's all for today and all for the week. As usual, pass this on to anybody who you think might enjoy watching it, and I will be back to you next week with more news.